it's Hospice Joe. Today I want to talk to you about active dying phase. So near the end, the last days, couple days, patients turn into the active phase of dying, which basically they're comatose. They aren't eating, they aren't drinking, minimal urine output, if any, really not having bowel movements at this point. Not our goal is to manage the symptoms. So mainly manage pain, manage breathing issues. We start morphine, more of a regular schedule, as well as haloperidol for some terminal restlessness, or they get nausea, vomiting from morphine. And icosapine dries up secretions. We might use that. And we give Tylenol suppositories if needed for the temperature regulation, because sometimes they get hot, cold. They can't regulate the temperature because the oxygen's not getting to the brain, the circulation. And we just try to support the family as much as possible, because, yes, this is the most difficult part, as far as I'm concerned, of this process, because it's a waiting game, kind of. And, of course, we know who's in charge of when it's going to happen, but I try to give families the best educated guess of when I think it might happen, just so they have a better idea. We are open 24/7, 365 days a week. Please call your hospice provider if there's any symptoms that are managed. If your loved one's moaning, if they're throwing up, anything that is not managed and they look comfortable, call. And we can increase medications, do visits, whatever is necessary to make them as comfortable as they can be in these last days. So I just am so thankful for people that take care of their loved ones at home during this time. It's just such a loving, selfless act. And the Lord sees. And all I can say is it's just a precious time. And I'm beyond grateful to be a part of helping educate families and do this. And once again, MACI catheter. MACI catheters go in the rectum. They're a very small tube where we can inject medications through just one port. It's not hard to use, folks. I encourage you to use it. So I hope you guys all have a blessed weekend, and I just pray for an amazing transition for your loved one. God bless.